It's been a busy period for the Scottish COVID-19 inquiry, and I wanted to update you on our work. We've made significant progress gathering evidence and hearing from those affected by the pandemic. We've completed our public impact hearings in June. Since 2023, we've taken nearly 700 witness statements and heard direct from nearly 400 witnesses giving oral evidence at our impact hearings. More than 12,500 people across Scotland have shared their experiences with us through Let's Be Heard, the inquiry's public participation project. I want to thank everyone who has engaged with us so far. Your contributions are vital to our work. In August, we published a case study focusing on children and young people's experiences. More than 2,000 young voices shared how the pandemic affected their education, social development, and mental well-being. You can read that study on our website. In October, we completed 2 weeks of hearings involving experts exploring the science behind COVID-19 and the factors governments should consider during public health emergencies. These sessions examined 3 areas: international approaches, scientific considerations, and social and ethical perspectives. We heard from international experts, including New Zealand's Professor Sir Ashley Bloomfield and Dr. Anders Tegnell from Sweden, who shared how their governments balance virus risks against wider societal harms. Our scientific sessions brought together public health experts to discuss the effectiveness of lockdowns and alternative strategies. Finally, our social and ethical discussions explored the pros and cons of imposing restrictions on society. Evidence and recordings from these hearings are available on our website. Next, we will examine decision-making and the implementation of policies during the pandemic. We'll hold a preliminary hearing on the 3rd of March 2026 to outline those investigations and hearings. While we can't yet predict when we will publish our final report, we remain committed to establishing the facts, identifying lessons, and making recommendations so that Scotland is better prepared in the future.